Time now for the Friday injury report brought to us by the great Rothman. That's it. Our Rothman Orthopaedics, rothmanortho.com/PHLY. And joining us to talk a little bit of a knee issue is my man, Dr. Freedman. Doc, good morning, my friend.
Good morning, Anthony. How are you?
I'm great. Did you, any chance, watch the football game last night?
What? Just a little bit of it.
Now,
Yes.
You as a brilliant man, Princeton, University of Pennsylvania, I mean, the top schools, a brilliant man. Can you find anything wrong with football in the snow? Isn't it just beautiful?
It is. It's a good thing. Absolutely.
That's right. See, Doc knows.
Smart man.
I can't believe that there's people in the media that say that's a bad thing. I just don't understand it. It's all hot take and manufactured nonsense, Doc.
Our Snow Bowl is one of our greatest memories. We just honored LaShawn getting in the Hall of Fame for that.
I love it. I love that's a Birds man right there, Dr. Freedman.
Hey, I wondered, Doc, in the snow, are you less or more likely to get injured?
Oh, I think you're less likely because you can't, you can barely get traction, and these injuries that are caused by turf. Think about the fields that we worry about that have turf problems. So it's actually it's less likely because you can't get as much force, you can't get as much speed, and you can't get as much traction. So yeah, it's just fun.
Just fun.
Look at that. That's why you're the greatest, Doc. Our Friday injury report, obviously the headline is Paul George. He's going to miss a couple games. First, the hyperextended knee, which he's done before and he did the other night. Can you explain what that really is?
Yeah, well, when these athletes jump up and land, there are times when they just land awkwardly, and the knee bends backwards in a way that it's really not meant to do. So, that knee just kind of goes backwards like this, and the bones, when that happens, can bang together. And even in the absence of like a more significant injury, as those bones hit each other, they get bruised the same way that the soft tissue gets bruised, and then that causes some pretty significant pain.
Yeah, you don't think about it because the bone bruise from the hyperextension, it makes perfect sense that they're clashing, so the impact causes the bruise. What's usually like the recovery timetable for that?
Yeah, I mean, it really depends on the extent of the bruise that occurs and whether or not any other soft tissue around it gets injured. I mean, I know they're talking right now that hopefully Paul George is only going to miss a couple of games, but it can be hard to predict because, number one, when those bones hit each other, sometimes it bleeds into the knee, and that swelling causes pain, and that blood in the knee causes pain and takes some time to recover. And then also just the bones itself, like if they continue to hit each other as you go into extension, and he needs to do that to jump and land, it really causes discomfort as well. So, even though they're saying a couple games, you never know. It could end up being a week or two that it's still causing pain when he tries to play. Now, the good news is I don't think he'll get a more significant injury if he tries to play through it, but it still can be tough, and it can be tough to play at the level that you want to, getting on the NBA court.
So this is what is concerning, I need to ask you about it. This is now the second time he's done it in, a matter of a month. Like, is he more susceptible to doing that? Or is it just freak? Is it, long-term? Is there issues? Like, having done this twice now, what's the ramifications?
Yeah, I think it's unlikely that long-term it's an issue. However, in the short term, as we're talking about, these first several months of the season, yes, I think he is likely a little more susceptible. I mean, number one, some people, because they have a little bit of laxity in their knee, can be more susceptible to begin with. And then you get some muscle imbalance that can that can cause it to occur more frequently. And he probably still had some slight muscle imbalance from his first injury in October that then let this happen. So I do think that they have to be a little careful that, is this going to be some nagging thing that potentially can reoccur through this earlier part of the season? If they can actually make the playoffs, I mean, I doubt it's going to be a problem then, but or long term. But yeah, we're going to have to watch how it does over the next few months.
Hey, I did just a personal question. What got you into sports medicine? Like, was it were you a fan of sports your whole life, and you wanted to make that your specialty?
Yeah, it's a great question. I mean, I've always been both a fan of sports, as a former athlete growing up. It's just something I always wanted to do. I was always interested in, how, muscles worked and the body worked. And, my family loves that I have some essay that I wrote in ninth grade that said I wanted to be an orthopedic surgeon specializing in sports medicine. So, I was one of those guys who got to live out his dreams. It's good.
That's awesome. That's a beautiful thing. Congratulations. I love hearing that. That's cool, man.
What else is cool? He's got Yoshi behind him from Super Mario. What's up with that, Doc?
Yeah, I had to find an office to sit in to do this. So it's all good.
We appreciate it.
Dr. Freedman, you're the man, buddy. We appreciate it very much. And go Birds, right?
Absolutely. Go Birds.